When you hear the phrase plastic surgery, what's the first thing that comes to mind?
Oh, it's usually celebrities, right? Or, but, cosmetic procedures.
Exactly. But when we dug into the sources for this, we found the real history is, well, it's radically different. Its roots are so much older and born from really just profound necessity.
That's the whole story here. We're tracing this field back to its origin, and it was never about vanity. It was all about reconstruction.
Reconstruction, right? Restoring function, restoring a person's identity.
And their dignity, which was crucial.
So let's unpack that. Why did this whole massive discipline start with one specific thing? The nose.
It's a great question. It's because the nose is just so central to who we are, to our face.
Mm.
And historically, losing your nose wasn't just an injury,
It's a social thing.
a huge social thing. It was often a punishment for a crime or a result of war. It meant you were sort of cast out of society. So restoring the nose meant restoring the person's entire place in the world.
And the first real technical manual for this, it takes us way back. We're talking ancient India, around 600 BCE.
Mm-hmm. To a text called the Sushruta Samhita.
And this isn't just some footnote. I mean, this is one of the world's first true medical encyclopedias. It predates so many Western texts.
And the technique they describe in there is just, it's genius. It's called the forehead flap.
Okay, so what is a flap? Break that down.
It's the core idea of all this. They knew you couldn't just, stitch a random piece of skin on. They took a flap of skin from the forehead, but kept it partially attached.
Ah, so it was still alive. It still had its blood supply.
Exactly. It's life support. They'd pivot down to form the new nose and only cut it free once it had integrated, once it had taken root. That's viable tissue transfer thousands of years ago.
Incredible. So that knowledge slowly makes its way to Europe, and we get this huge milestone in 1597 with Tagliacozzi.
Right. And he systematized it.
Yeah.
But he used a different method, the Italian method. He used a flap from the upper arm.
The arm. Why the arm? That sounds so much more complicated.
It was incredibly complicated and painful. Think about it. The patient had to have their arm strapped to their face for weeks.
Wow.
But it shows you the problem they were trying to solve. They needed more tissue than the forehead could sometimes provide. The key, though, is that he wrote it all down. It was a reproducible blueprint, not some secret art.
And all these different techniques eventually needed a name, right? A field.
Yep, and that came in 1838. A surgeon named Edward Zeiss coined the term plastic surgery, and that officially created the discipline we know today.
But the field didn't really explode into its modern form until a global catastrophe forced its hand.
World War I.
The scale of the injuries, it was just something no one had ever seen. The shrapnel, the weaponry, it created these horrific facial and jaw injuries.
It demanded innovation almost overnight.
And that's where a figure like Harold Gillies comes in, around 1917. He was basically on the front lines of this.
He had to be. He took those foundational flap techniques and just rapidly advanced them, developing methods that are, the direct ancestors of what surgeons use today. It's really the dawn of modern plastic surgery.
And from that intense focus on function, the aesthetic side started to become more scientific too.
It did. And you have to give credit to Jacques Joseph there. People call him the father of modern aesthetic surgery. He systematized procedures like rhinoplasty to fix both function and appearance together.
He made it repeatable, scientific.
Yeah, exactly.
So the big takeaway for you here is that the story of plastic surgery isn't one of vanity. It's fundamentally a story about recovery, about human dignity.
It is. And that leaves me with a final thought for you to consider. If the defining reconstructive challenge of the ancient world was the nose, a problem that demanded a revolutionary idea like the tissue flap, what current medical frontier will future historians look back on as the defining massive-scale challenge of our time?